There are many reasons why hives and rashes occur. Some may be environmental, while others are due to allergic reactions to food. We asked Dr. Michael Cater of Children's Hospital of Orange County about the more common rashes that he treats in his patients.
I think you could classify rashes into several large groups. We see lots of rashes that are a result of infection, both viral, like roseola, or fist disease. And we see rashes that are caused by bacteria, for example, impetigo. We see rashes that are caused by contact with a foreign agent, poison oak is an example. We see rashes that result from a reaction to medication that they're taking orally. A good example would be hives. The rash may be a manifestation of a systemic illness. Many hives that we see don't have a defined cause, and it's thought in many cases to be due to a viral illness. Rashes can occur anywhere. The infectious rashes like impetigo can occur on the head or trunk, extremities. We see herpes simplex rash, of course, which is an infectious rash, usually around the mouth and the nose. The rashes from contact dermatitis tend to be just about anywhere on the body too, as well as hives.
We asked Dr. Cater, how are rashes diagnosed?
90% of the time you can make the diagnosis for the rash by its physical appearance and its clinical presentation. The one that comes to mind that's probably the most common is a condition called eczema or atopic dermatitis. It's seen in people who have either themselves or their family members have a history of allergic conditions like asthma or hay fever, called allergic rhinitis. And it's a common malady in pediatric medicine. Hives tend to be very itchy. They tend to migrate around the body at different sites. They'll fade at one site and come up on the other, and can be mild or they can be very severe and very uncomfortable. Well, a lot of rashes come and go in a day or two, and the cause is never identified. But I'm always concerned about a rash that's painful, one that persists, and a rash that's associated with a fever or other systemic complaints like sore joints, abdominal pain. Those rashes need to be identified.
We asked Dr. Cater how certain rashes are treated.
Well, it depends on what the rash is. If it's due to an allergic contact, then usually some topical steroids and some diphenhydramine, which is Benadryl, are going to suffice for a few days. If it's impetigo, which is a form of bacterial infection of the skin, it generally is going to need some antibiotic, either in the form of a topical antibiotic or oral antibiotic. If it's a viral rash, it's going to be self-limited and go away in a few days.
And when should parents become concerned about a rash?
If the parent sees a rash and they don't know what it is, what I like to do is have them call their pediatrician. And they can usually get some good advice from the advice nurse in the office or the physician himself, because there are hundreds of different kinds of rashes. And for most parents, it's a real maze and a difficult challenge to identify what the rash is. But with a careful history and many times a careful physical examination, more than 90% of the time you can identify the source of the rash.